So, hi, welcome to the weekly meeting of the BC Association of People on Opiate Maintenance. Our mission, we are a consumer advocacy group, and our mission is to support, protect, and defend opiate maintenance users' rights to live free from obstacles caused by
prejudice and stigma.
Prejudice and stigma. Thank you. So I think the next thing is going to be my message.
Oh.
Okay. So my name is Raya. I'm the Vice President of the BC Association of People on Opiate Maintenance. I see a lot of familiar faces, folks who come to our group every week. We are people who are on opiate maintenance, methadone, Suboxone, Cadian, Dilaudid, Hydromorphone, Emeslon, any prescribed opiate product, right? These are our members. These are our people. Some of you might be surprised to see media people here. We're doing an action. So this is going to be kind of a different meeting.
A good meeting.
A good meeting, Israel says. A bit of a different meeting than what you're used to, right? We've decided to do this because the numbers that have been released, the overdose deaths, the preventable overdose deaths, have increased in 2021 by about 26% compared to the year before, right? These are preventable deaths, right? So DULF has generously offered to provide our members with a safer alternative to street drugs. Because many of us, and you know this, many of us are on high doses of methadone, right? We're used to using poisonous street drugs, fentanyl, benzodope, right? And so it can be hard for us to get high, you know? So we're not saying that what we're providing today is perfect, right? But this is an example of what's possible in a compassion club model. Also, our mandate is to reform the system. And so we're encouraging you to give us feedback, right? Take the drugs if you want, try them. We've got a little feedback form. Bring it back to us. We'll give you a little stipend for your feedback. And then we're going to actually discuss that feedback at our next meeting, right? And we're going to discuss it on the board level. This is an example of a person-centered care model where you have a direct impact, a direct say on the drugs that are going into your body, on what you're allowed to consume, right? You get to choose. You get to be a participant. Right? So this is a way to show the government that there are other ways to do this. There are better ways to do this. And we can't get anywhere if we don't center the person who uses drugs. Right? That person has to come first in their care. We need to ask them, what do you need? And then we need to listen. And if what we're giving them is not good enough, then we have to be willing to have them come back and to listen to that feedback and to take it seriously, right? So this is sort of the birth of that kind of movement. So anyway, that's what we're doing, folks. I think the next thing we're going to have is we're going to have opening remarks from Manny. Thank you.
Oh, that's nice.
Ossiam Nasieya, Antamanda Axel Strain, Tanitra Alcohol Masquim. Amit of Cookleven. Hello, my name is Manny Axel Strain. I'm from Musqueam, and I just wanted to welcome you all today. And I just want to express gratitude to my relative TJ, to Eris, to those that spoke before me for asking me to be here today. This is a topic that is very near to me as well. The amount of Indigenous people that we've lost is far too much and far too disproportionate. And I think a lot about all the loved ones that we've lost, and my relatives, and my friends, and I'm thinking of them today. And I just want to express gratitude for what you said about centering the person in this scenario. I was thinking a lot about this today, and I was thinking about that we really need to love those people and care for them the way we would love for our family. And we cannot leave them behind. And it's also, for me, about survival. And I think a lot about genocide. And I think a lot about the history of genocide. And where does this play into that history? What is the history of genocide today? And that's what I'm thinking a lot about today. So again, I want to say thank you for asking me to be here. And I just encourage those that are here, those that are there, to listen, to really, really listen to what is being said today, because it's so important that we ensure our survival, our lives, and not only that, but our thrivings, that we thrive, and that we too have something to say, and that we are valuable people that need to be treated that way. So I'd like to say, Haichka Siem to you all for taking on this really important and hard work. This isn't easy. This is not easy. And we all have loved ones that we're thinking about right now, I'm sure, because of the massive amount of numbers. And so I think that's it. And I'll raise my hands to you all.
Laura, you're next.
Okay. Hi. So, my name's Laura Shaver. I'm the president of the British Columbia Association of People on Opiate Maintenance. I'm a 12-year, veteran or longtime board member of the Vancouver Area Network of Drug Users. I am a daily drug consumer as well as the provincial opiate advocacy navigator. So for people who are on IO, which are opiate replacement therapies, I help you to do your complaints and, quote, try and navigate this. There is no map. It's a map we're making of the medicalized, excuse my language, but fucking mess that there is, quote, the government has left us to fix. You know, you can't expect somebody to be on a program that isn't even made. That's one of the reasons why we're doing this symbolic action today, is because of the fact that even, you know, the coroner said it to me in an interview, the Minister of Health said it, you know, we know that these are preventable deaths. So that means, to me, they just told me that 2,266 people that are dead. No. Sorry, number's different.
It doesn't matter.
There you go. So we're not going to fight on the number. We've got the 266 number. Yes, it says 224, but
That's
a minimum. Yes. So the thing is, you know, you hear these, quote, authorities saying that this is preventable, then what then what? You know, the interviewer asked me, what do you want me to say to the minister? And I said, resign! Tell me where to pick up my prescription. Which pharmacy am I going to? That's what I said. That's all there is left to be said. We know where we're going. We know what we need to have done. Why isn't it happening? And it's not numbers. My name's Laura. Charisse was Charisse. Aiden was Aiden. Tracy was Tracy. I'm tired of numbers. We're not numbers. We are people. We bleed red, the same as anybody else. And the thing is that we are still dying at least 4 people a day, which means now there's not an if for me, it's a when. So when am I going to die? Oops, shit, sorry about that one. Oops, and that's another story, that's my phone. But that's the thing, and that's why we're doing this symbolic action today, is because we have to. We're taking this into our own hands because the government has failed us. You get an F. You failed. Okay? When there are 26% more deaths this year in an emergency, then excuse me, but do we not, my life matters. You're telling me my life and other people's and those that have died don't matter. There are still more people dying a day from a fentanyl overdose than there is from COVID. Okay, now that's a problem. It's a problem that they know and they admit. And they also admit that there's a solution. So the thing is that what is stop? Why not? You know, that's why we've done it here at a British Columbia Association of People on Opiate Maintenance meeting, is because it is our voices that need to be heard, and it is our bodies and our minds that are dying. It's us. It's us that are suffering. You know, the thing is to me, the slaughter started when they switched us from methadone to methadose. It tells you that 75 to 80% of the people that were switched to a medication that they had no choice for relapsed or went up in their methadone scripts. So to me, that means that's 75% of more people that could have probably had a chance at life and now are dead. Because to me, withdrawal means death. And the thing is that even the programs that there are in place are insufficient. I have now been put on diacetylmorphine after waiting for 10 years, but it is inadequate. Compared to the fentanyl potency, it is not enough. And with the benzodiazepines in it, it's not enough. Now we don't have the proper reversal medication to revive somebody from an overdose benzodiazepine, because we do not have that antidote here. So now what? That means that we are here, now we're just breathing machines until an ambulance gets here and gets you to the hospital. Okay, we know that there's a broken system. We know this. We've been talking about it for years, but we also know that there's a system to fix it, or many different systems that could at least be tried. And yes, there's a start, but the start is not fast enough, because that's why I'm saying, how can you have a, quote, health emergency that is into its 6th year and that has gone 26% up in death? To me, isn't that murder? Is that not murder? If they know this and we have the antidote, then why are we not using it? Why don't you? Then that means you're telling me that my life and all those people that use and consume or have no choice but to self-medicate, that they're going to die. Because I know, the one thing I know out of anything, the one thing I know for sure today is that there will be 4 people dead from an opiate overdose. That's the one thing I know, and I know for sure. There's no ifs, ands, or buts about that. And to me, that's pathetic. See? And 6. So that, you know, that's, you guys, I cannot, the moment of silence now, I don't have enough time to mention all the names of the people I've lost. And I'm not just talking about people. I'm talking about people that would know my birth date, my dog's name, my family's name, that's when there's that many people that are dying, you can't tell me that in this room it's not touched everybody. And if you say no to me, I'm sorry, I think you're lying. And that's the difference between you and me, is that I'm not afraid, sorry, not you and me, but the people that are viewing this from through the media, is that I'm not afraid to talk about. He's okay. To talk about my life and who I am. Do you know why my dog is barking? My dog is barking because he is not. Somebody is sleeping and she's afraid it's an overdose because she has alerted us now 2 times to 2 separate overdoses. Right? The thing is that all I'm here to say is that we are a membership that gather here each week except for the week of welfare that are on prescribed opiate medications that are insufficient. This is the one time that we have to have our voices heard, because that's what we need. Because there is nobody else that can fix this, that can actually implement the program properly, except for those that are affected by it. Because this is not just a job. This is making sure that I'm going to make it to bed tonight alive, and that I'm going to wake up alive. That's the difference. And the thing is that it's preventable. Everybody said these are preventable deaths. So then there should be nobody dying today. There should be only births, not deaths. So please, I want the minister to tell me which pharmacy am I going today to pick up my illicit replacement that is safe. And my own choice that I'm allowed to take away from that pharmacy without worrying about you asking me to pee in a cup. Oh, Laura, just a little tiny bit. We only need a little bit to show. To show that I have illicit fentanyl in my urine. To show you that there's deadly benzodiazepines. We know that. That's fear. It's punitive death. You just want to have something to hold over me to tell me why you get to tell me what medication I'm on. So guess what? There you go. So we're here to tell you that if we can find the illicit replacements that will not kill us, then so can you. We will take you there. We will do it. But please, sorry, that's my dog barking her displeasure over something. My point is that we're here to organize in a symbolic action that this is not just a free drugs. This is a movement. This is a show that we can do this and that we are organized. We are here to stay, and this is to show you that we will continue to do this, and it will only get bigger. And the thing is that the preventable deaths, then prevent them. Prevent them. Quit talking to me and show me some action so I don't have to go to another funeral or call my family and say, can you please get that family plot ready because it will be filled. If they do not stop this, I will be dead. There is no ifs, ands, or buts anymore. We know that, and I know that. And to me, that's sad, and that is it. They talk, we die. No more talking. They talk, we die. They talk, we die. They talk, we die. I'm not prepared to die. I'm here for change. And change is this. Change is Compassion Club. Change is choice. Change is the British Columbia Association of People on Opiate Maintenance. Change is the Vancouver area network of drug users, drug consumers, because you know what? Just because we consume drugs means nothing. It just means that we're truthful about our medication. That's the difference between us and people who will step over us instead of pick us up.
Check. Hey, we don't have good equipment. We might not have so much money, but we do have a lot of heart here at VANDU. And we have love, and we have care, and compassion, and community. A thing I don't think a lot of folks, when they think about the downtown east side, realize. This community, the community that they are killing one by one, is my home. And it is a place that I want to live and continue to live for the rest of my life. 2,224 people are dead. 2,224 lives, individuals that we know, our friends, our family, our relatives, people's children. They're not going to come back. And why, might you ask? Because the government, the Canadian state, refuses to address the failure of prohibition. It is the failure of the regime of prohibition, the fact that drugs that people choose to consume are killing them because they do not know what is in them. That is what is driving this number. And we are demanding that the government dismantles the Controlled Drugs and Substances Act, grants DULF, the Drug User Liberation Front, our request for a Section 56 exemption to be able to run compassion clubs that distribute cocaine, heroin, and methamphetamine in tested, clean, and predictable compounds. If I go down the street, if I go down the block and buy a 10 paper of heroin, of down, I do not know what is in it. I do not know whether or not it is contaminated with benzodiazepines. I do not know whether or not it's contaminated with fentanyl. I do not know whether or not it has drywall dust or rat poop or God knows what. We need regulation. The deregulation of alcohol did three things. It increased how powerful organized crime was. It increased the potency of drugs because alcohol, I should say. Alcohol is easier to smuggle when it is more potent. And it also increased the toxicity of the alcohol supply. The war on drugs is identical. It is doing three things: increasing the toxicity of drugs, making them more poisonous to the people that are taking them. It is increasing the potency of the drugs because more potent drugs are easier to smuggle. And it is increasing the power of organized crime. And this government, the Canadian government, has abandoned us to die. Shame! Shame on the Canadian state for abandoning drug users to have to figure out how to get ourselves clean drugs, and that is the model we will be demonstrating here today. To date, of the 150 grams of drugs the DULF has distributed to our community, there have been 0 overdoses, either fatal or non-fatal. We know that if people know what they are putting into their bodies, nobody has a death wish. Maybe you're seeking euphoria. Maybe you're trying to cope with trauma that has been dealt both historically or otherwise. But we know that if you choose to use drugs, that should not be a death sentence. And you cannot recover someone who has died. Shame on the Canadian government. 5 years into this crisis, going on 6. How many people have to die? When the COVID-19 pandemic hit, there was a rapid response, and the government releases data related to COVID-19 frequently to the public. Why is it that we as drug users have to release the data ourselves, have to do everything ourselves? We have been abandoned. Shame on the Canadian state. Shame on the Federal Minister of Health for not coming and talking to drug users about what needs to be done and how change has to happen. Because so long as the Canadian state is not listening to drug users who they refuse to engage, we will not see change, we will only see death. This is a terrible day, and this is a terrible thing to have to announce, you know. I'm sure many of us know folks who have passed away. I respond to overdoses. The last overdose I responded to was 2 days ago. And because of the amount of benzodiazepines a person had taken, they were not even awake when they were being taken away in the ambulance. I have not seen a crisis this severe in my entire short 31-year-old life. It's abysmal that we have to respond to the overdoses, that we have to provide the safe supply, that we have to announce these numbers. But you know what is not abysmal? Is this community. The fact that we have each other, the fact that we have heart, that we care, that we can keep each other safe and alive to the best of our ability. And we will not be here if the system does not change. I will die. My friends will continue to die. The people I choose as my family will continue to die. You know, I think there's a very important Malcolm X quote that's relevant to this situation. If you stick a knife in my back 9 inches and pull it out 6 inches, that's not progress. If you pull it out all the way, that's not progress. The progress comes from healing the wound that the blow made. They haven't even begun to pull the knife out. They won't even admit the knife is there. That knife is Canadian drug policy. That knife is a Controlled Drugs and Substances Act. That knife is piss tests and prescribers. We do not want a prescriber model of drugs. I should not have to see a doctor to get access to a safe supply of drugs that will keep me safe. Shame on the government for forcing us to jump through such ridiculous hoops. Witness dispensation. You can only have 2 weeks of carries, or 3 days of carries, or 1 day of carries, or we're going to take your carries of drugs away. Shame! That is tantamount to murder. That is genocide. You are killing us. And while you talk, we continue to die. We will demonstrate that we know what's right. And what is right is keeping people safe. What is right is distributing drugs, is allowing people to have access to clean, safe drugs that have been tested so they know exactly what they are putting into their bodies. With no other type of market would you have dysregulation to the point that people are dying in massive numbers. Why is it that drug users are so subhuman that we cannot have market regulation? That is a death sentence. We have been condemned to death. And we will... faulty technology. We will continue to be condemned to death unless something changes. The federal minister of health needs to meet with us immediately and discuss what we need. Not what they think we need. Not treatment beds. Not, millions of dollars of addiction funding being wasted. Colossal amounts, millions upon millions of dollars are dumped down the drain each year when the solution is right in front of their eyes. And I could go on, but I think, again, I want to bring this back to what's important, which is us, and us keeping ourselves safe. We're going to distribute some drugs, 3.5 grams of cocaine, heroin, and methamphetamine from a table over here. These drugs have been tested by mass spectrometry, by amino acid dipsticks, by FTIR testing. To the best of our ability, we are doing what the government should be doing. And we hope you enjoy the drugs. Haha. Hey, before, we're going to have a moment of silence, too, before everyone gets all rambunctious about the drugs. Whoa. I've also been asked to read a poem, so if we could just have a... Al, that's your name, correct? What's his last name? Just Al. Alan. So, I'm going to read this poem, and then you're going to do the moment of silence following this? So here we go, Al's poem on this February the 9th. Today we stand alone together. Individually we all speak of forever. All voices calling out, be alone never. Those that see us alone know not ever. Daily we fight a war of poverty and drugs. Where are the days gone? All we needed were hugs. Daily are fighting dirt swept under rugs. Jeez Louise. Pick up our dirt. Stop fighting wars on poverty and drugs. Our wars have taken too many and too soon. Families and friendships left only for ruin. Please hold out your hand, grab mine, do it soon. No longer are soldiers left only for ruin, for if we all stand alone but do it together, we'll surpass all storms and all kinds of weather. We can stop this war if we do it together. No more losing soldiers. Never, not ever. My friends, we can do this alone. We can start. Reach out to a brother from the depths of your heart. To you, my brothers, these words I impart. Let's do it together, knowing now where to start. Not again ever should we go to war at all. Hold our heads up, be proud, and walk tall. Silently watching, keeping track of it all, for no more any soldiers needing to fall. And with this I say, all power to the drug users. Keep each other safe. Remember to carry naloxone. Remember to treat people with respect. And remember to keep this fucking community alive. Because it is one of the last beautiful places left on earth.
Hi, everybody. Thanks for coming. Thanks for lying. It's a tradition at VANDU and BCAPOM. Oh, I touched the thing. That's all. Touch it. No, touch it. So, I'm not touching it. So, if people can remove their hats, please. I'd like to take us out to a moment of silence here. Just a moment of silence for all the thousands of people who have died. 2,224 people. And I think that's just a small number. Recorded, I bet you there's hundreds more that we don't know about. But if you have any dedications, now's a good time to say them out loud as loud as you can to the people that you know that we've lost that aren't here. They're here with us always. VANDU, you're a member forever.
Risky Warren, Larry Preston, Charlie, Ken, Ron Cookie, Tracy, Chester, Aiden, Lori,
This moment of silence goes out for the ones we mentioned and the ones we haven't. All my relations, thank you very much, everyone. Appreciate you coming here. It's now a movement. We are going to do it for sure. The answer is here, and we're going to give it to you. Yes, we did. Thank you.
Hey, does someone want to talk about the giveaway and how this is going to work? Anna?
Yeah, sorry, really
So we'll now be doing the distribution. We're going to be calling the names based on the list of people who signed up. You have the option of choosing one substance out of the three that are available, which are crystal methamphetamine, heroin, and cocaine. You will be given the option to choose two out of those three substances. So when we call your name, you can collect the drugs from over here in addition to your stipend for the meeting. So just, we encourage patience and orderliness as best as we can.
Yeah, start with the members and the supporters after. So,
They're starting with the members and then supporting. Nick D.
Come on up, Nick. Step right up.
Nick D. Please, Nick D. I'll keep trying to shut the names out.
Tom R. Come on down.
Hey, come back to the meeting. Come back to the meeting. You can tell us about it. You can tell us about it. Wednesdays at
It's like Christmas. You know what we're doing.
Okay, Ryan M. Ryan M. Ryan down. Here I am. What do you like?
Who?
Here we go. Right on, brother. Sign here. I'm going to give you $5 for anyways, I've got to go. I just want to see Okay, Nicole B.
Nicole.
Nicole B.
Nicole B.
She's got my phone, so maybe I can bring it to her.
Okay.
What would you like?
Okay,
I'll bring it to her. What would you like?
Which drugs would you like? Side and down, please.
One side, one down.
We have heroin and meth. Great.
What are actually... Are you going to do it up here? There we go.
Okay, Clint.
Clint.
Clint B. Come on up, Clint. Mr. Clint. Look at us. Can I get you?
Come back to our next meeting. Tell us about
I'm a state. You got it. Curtis T.
Yeah,
Curtis! Come on down. Come on up, Curtis.
Curtis.
You're the next contestant on free drugs. Where's Curtis at?
Curtis to the free drug table.
Drugs are right. Come on up, Curtis. And left. I've got three clean. What? Three clean drugs. Exactly. Safe. John H. John H. John H. John H. Come on up. Here he comes. On down. Yes. Clean drugs are right. Cheers. Have a good one, man.
Come back to our next meeting. Tell us about the drugs.
Al H.
Al H.
He's in mobility issues too.
Al
What would
H.
you like? Oh, he's got here. All right, we can go right here. Come on. What would you like? Two. There you go.
Come back to our next meeting. Come back to our next paper, right? Tell us about the drugs. We'll give you $5.
Victor.
He might have some
There. What would you like?
over there.
What would you like, Victor?
What would you like, Victor? Cocaine.
Two cocaine?
Cocaine for Victor. Patience is a virtue. Tammy.
Brian O'Donnell. What can I get you? Brian's the man. He always makes noise.
You have to call your name.
Call your name. They shouldn't have called you yet. Well, they shouldn't have.
Just confusing me.
What did you want? Cocaine?
Is it powder?
It's powder, yes.
Wait, we still got someone doing DULF security? Thank you, Al. I'll follow it.
Bring back the sheet of paper.
Valerie.
Can you either come to our next meeting or come?
Hey man, bring a tea. What does she want?
What do you want?
Like I'm.
Oh, we just got someone
You're super tall.
Yeah, one on the left. Why don't you get a manicure?
All right, we have Martin. Come on
Bring this back. $25 for it.
Al D.
Oh, but
Al Fowler.
Al Fowler.
Al Diablo. Yeah, we have Chad. Chad Gilman.
Bring back the orange sheet. Tell us about the drugs you got $5, right?
Chad. Chadwick. Simon L.
Bring back this orange sheet. Tell us about the drugs. Good? $25,
Two more people here. Tanya. Tanya. And there's 3 supporters after that.
People used to say go G. And then there was OG.
And Cassidy. There's supporters. Let's do those last. Supporters last. Cassidy. Yeah.
Cassidy?
Last call, Cassidy, and then 3 supporters after that. I did the drug addicts first. Sorry.
Cassidy?
There you go. Tradition of BCAPOM, we do the supporters last, right? Okay, Earl Brayons, come on down here. These are our supporters. Thanks for supporting us.
Yes, the people's chant. The people's
Stand
chant.
right there, brother. I can't get you. Jason D.
Sorry, it's only for the people. Next time. I know, but no, sir.
Come back now.
I'll talk about that.
Come back. You get $5 too?
$55.
Jason D. Come on down.
I'll call you.
Marie is the last person.
Marie, you're the last person.
I'll bring it tomorrow.
Hey, thank you everyone for coming out today. I'm glad this was such an orderly process as per usual. You guys are BCAPOM board.
Thanks for coming, everybody. I appreciate it. Okay, we get BCA on board now.
Sorry. Next time, though, there will be a next time. Is that? Have you guys done the full giveaway? Are they done? Hey, Saul, I think you can kill the stream.